So today's topic is photobiomodulation for analgesia and wound care. My name is Dr. David Kanashko. I'm the Director of Education and Research and Training at Meditech International, based in Toronto, Ontario, Canada. And we manufacture and clinically support photobiomodulation medical devices. Phototherapy has been around for a long time. Recently, in the early end of the 19th century, phototherapy was used by Dr. Niels Finsen. And Dr. Niels Finsen ended up using red and ultraviolet wavelengths to treat smallpox, skin tuberculosis, and measles. He, in fact, was awarded a Nobel Prize in Medicine or Physiology in 1903, and shortly thereafter died due to complications of Pick's disease. Phototherapy is used quite prevalent in allopathic medicine. Of course, blue light for jaundiced babies, bright white full spectrum light for seasonal affective disorder, and ultraviolet B narrow bandwidth for skin conditions. The term photobiomodulation therapy, or PBMT for short, was added to the MESH database in 2006. It previously replaced a term called low-level laser therapy, or LLLT. It's a form of light therapy that uses non-ionizing forms of light sources. These include lasers, LEDs, broadband light in the visible and infrared spectrum. It's a non-thermal or athermal process. The light is under 500 milliwatts of total power. It involves endogenous chromophores, which then elicits a photophysical or photochemical event at various biological scales. This process results in beneficial therapeutic outcomes, including alleviation of pain or analgesia, a reduction of inflammation, immunomodulation, and promotion of wound healing and tissue regeneration. The use of low-level laser therapy has been researched widely, and it's thought that the light can interact with thinly myelinated A delta and unmyelinated slow-conducting C fiber pain fibers. Of course, we know that this complex transduces noxious stimuli into action potentials. The light can actually help to block this type of pain. Of course, we know these are located relatively superficial and are easily accessible by light. This particular study talks about the cell bodies or neurons that lie within the dorsal root ganglion. And of course, these extend all the way to the bare nerve endings of the surface of the skin. Low-level laser therapy, or PBMT, when applied with sufficient level of intensity, can actually inhibit action potentials and cause a neural blockade within 10 to 20 minutes of application. And the pain relief can last up to 24 hours. It is a reversible technique. Essentially, ATP is synthesized in mitochondria where they are located in the dorsal root ganglion. These mitochondria are then transported along the cytoskeleton of the nerve monorail system of molecular motors and axons. Here's an example showing you the transport of mitochondria. So laser therapy actually acts as an anesthetic agent in both along the cytoskeleton transmission, as well as forming reversible varicosities or beading along the axons. Here's a picture to show the before and after using, in this case, near infrared 830 nanometers of wavelengths of light, showing you the varicosity that blocks the transmission of pain. The exact mechanism is still unknown, but is not considered to be a thermal action. The most immediate effect of pain blockade of this nociceptor blockade is pain relief, which occurs in as quick as a few minutes after the application of laser therapy. This inhibition of peripheral sensitization decreases the release of pro-inflammatory neuropeptides, for example, substance P. And in persistent pain disorders, this reduction of tonic input is activated by nociceptors and synaptic connections and leads to long-term downregulation of second-order neurons. This modulation of neurotransmitters is a further possible mechanism of pain relief, such as endorphin and serotonin release. Thus, laser therapy can have a short, medium, and long-term effect. Essentially, laser therapy is modulated in different ways of dose response. And it's known that higher dosages of light can cause this analgesia effect, whereas lower doses cause more of a therapeutic healing effect.